Hey, practice owners. We're back with another edition of Coming Back Stronger, and I'm really excited to have our guest today, Andrea Greer of On Point Space. And I was telling Andrea before, one of the things that resonated with me, and back in, we'll call them the regular times, the old normal, is Andrea helps you with sort of the aesthetics of your practice. And she used to have these in her presentation. She'd have all these neat little pictures of stuffed animals in the operatory. And, I remember one, Andrea, where like I said, you said, oh, there's a dog and a giraffe, and I don't even know what that animal is. And even at that time, I think your message was, that's probably not very hygienic for a
Right.
medical environment. But even now, it's more so. So welcome, Andrea Greer, On Point Space. How you doing, Andrea?
I'm great. Thank you.
You're in quarantined in Texas. Yeah.
Yeah, quarantining in Austin, Texas.
Good deal. So
Yeah.
can you share what, how Andrea's background and how she got to where she is today?
Sure. I feel old when I say this. I have 28 years in dentistry. This is my 28th year. Assistant, hygienist, office manager, Dentrix trainer, consultant, author, speaker, Dentrix enterprise trainer. So I've been around. I've been in a lot of offices. And in the time that I've worked, I've done a lot of practice management consulting, even as a trainer, just kind of combining the two. But I've also done work with teams, helping them to really understand how the practice aesthetic relates to the patient experience.
Yeah.
And so the presentation that you're speaking of is exactly that, is a presentation about making sure that you're putting your best face forward with your patients and that they understand how you understand as a practice owner and as a team member, how the practice aesthetic supports the patient experience. And it comes in a variety of things. There's a lot of things that we got to be thinking about. A lot like what you said about the clutter in the treatment rooms, especially, and making sure that our rooms are reading as clean. So yeah, and then
that was one. The other one that jumped out at me, and see, I really do pay attention when other people are speaking, was this beautiful reception area. And you had a picture up there on the screen. It was a beautiful reception area, amazing furniture and artwork, and a big beautiful glass coffee table. And it felt like you were coming into a spa. It was really awesome. And I thought, well, that looks neat. And then you said, but imagine you're a mom with a couple little kids, and you come in, and the first thing you see is that glass coffee table. And the first thing in your mind is, okay, which one of them's going to, hammer something through that and break that? How dangerous is it?
Right.
And which is fine if your average patient, age is over 45. But if you're trying to be a family practice, that is a hot button for, a young mom with a couple of small kids that, I wouldn't give it a second thought. But, So that's really what resonated with me, are the things that as a practice owner, we might be doing today or have done for a long time and just not even give a second thought to. But, a mom with two kids or somebody who's a little, over hygienic in the past, well, today, and, we don't know, we're in the midst of a shutdown, but at some point in the future, when you come back, there's a whole different patient view of what hygiene means.
Right.
So maybe we jump in there and do a couple things. One is, the first question is, what can somebody be doing today? And today really is just emergent patients, right? If they're going to see them. And then, what can you do when you come back? What can you start looking at your practice and say, that probably might not be smart, or I might need to get rid of that. So how about we do that? Jump right in with the emergent patient part. What can you be doing today?
Sure. So, one thing I have been talking with clients and on webinars when I'm presenting and I'm talking about this is the concept is very, I haven't changed my message all that much. Then we really need to understand that patients have a whole new set of lenses that they're looking through. And that lens is called COVID-19. And they are much more aware than they ever have been about the transmission of disease, right? And so even right or wrong, we all know that some of that information may be incorrect, but we have, as healthcare providers, I think we have an obligation to help our patients see and feel the difference from before. And I know that offices, for the most part, I think a lot of offices are very hygienic. I'm sure that their sterilization techniques are fantastic. I'm not questioning that. The presentation that you saw, there were a couple of things that I showed in there about clutter and understanding how clutter impacts that visual for the patient, and how that really, they don't, no matter what the circumstances are, no matter how clean those teddy bears in that operatory were saw in that picture,
Right.
never be perceived as clean, right? So, and that's really the message that I'm trying to get, that I really want people to take away from this and do now, is let's start with the clutter. Let's just start with the clutter. I've taught for many years that your countertops in your treatment room should be about 90-95% clear of anything. So your disinfecting stuff goes below in the sink. Use vertical space. Get glove holders for your boxes of gloves. Get the brochures off your counters. Those countertops need to be cleaned off, because the brain instantly registers anything on the counter as dirty. And in a room filled with aerosols, it probably is. Those of us who have had the pleasure of watching those old infection control videos, if saliva were red, think about that. That it's everywhere, and that is, patients now are much more aware of that. And so I would say, for the doctor, for the teams that are seeing patients now, emergency patients, even if it's just emergency patients, start addressing the clutter in your treatment areas, because that's going to be a huge stepping stone right now to help overcome those fears that people are naturally going to be having moving forward.
So they're in pain. They're coming to see you. Maybe you decided to be open Tuesdays for the next, Tuesday each week. You're going to try and move your patients there, manage that schedule somehow. Paper is a big thing. In fact, I did another interview a week or so ago. I never gave it a second thought. And what the person who was doing it was talking about a paperless office. And while it's, it's dual purpose, it's really efficient and always has been, but it's hard to make that transition.
Yeah.
Well, today, patients are going to walk in and say, okay, they might even know in their mind. I mean, I don't know. You tell me your thoughts. It stays on a plastic surface for 7 days. It stays on a cloth surface for 12 days. I mean, they know this stuff now.
Right, absolutely. And paper, it's such an important concept. So in the past, I would always talk about how if we have paper lying around, how basically sends a message to our patients that we are not on top of things. We're disorganized. We may not be maintaining and making sure that we're getting all the things done that we need to be getting done. But now you add that plus this layer of fear and new knowledge that people, like I said, it may not be accurate, but they might be starting to question, if I'm seeing paper, if I'm seeing lots of, who's touched that? And if they, I go in practices all the time where team members still, even with good knowledge, still touch papers and charts and pens and everything with gloves on that are dirty. I see it all the time. And now patients are going to be hyper aware of how that is transmitting the bacteria. Now, I know that we have all seen the videos. They kind of crack me up, the photographs and the videos of people wearing masks in the store, and then they touch the mask and lick their fingers and put their mask. And I know that they don't understand, often don't understand. But there will be that patient who has a very clear understanding of exactly how this works. And we just need to assume everybody has that knowledge.
Right.
So having both or clearing up that clutter, that paper clutter, or the clutter in the counter, is going to serve a dual purpose. It's going to feel much more organized, which sends a message that is inherently creating trust, creating calm, and creating comfort when we can that message, right? So it's sending that message to our patients to help our anxious patients. But it's also helping those patients that have that knowledge about bacteria transmission. It's helping them to understand, okay, we are taking this very seriously. Maybe you always have. Now they need to feel it, need to see it, right? And they're going to feel that much more internally if they see you adhering to that, and they feel that cleanliness in the office, for sure.
And again, I think with kids, with we were talking earlier about, I have nieces and nephews that have young children. So I have sisters and sister-in-laws and brothers that have grandkids, and they are super hyper aware. It's mom, dad, and 2.3 kids, and they are, whatever the rule is, they just double it to be safe. So if we shouldn't see anybody for 2 weeks, it's 4 weeks. Or if it's we shouldn't touch this, we won't do that. And I think maybe in the past, we used to think wearing, if we're gloved up, that's good enough. Patients are fine with that. They feel like we're hygienic. But when they come in now, they're gonna, even if it's an emergent patient today, they're gonna have this feeling that I'm here to get my pain taken care of, but I also don't want to leave here with whatever their perception is. And maybe that's what I'm trying to say or ask Andrea, is the perception is really the reality. Whether you can't get in an argument with every patient and say, well, this is really how you catch it. If they think this is how you catch it, that's it. That's the reality, is their perception.
Right. Absolutely. So it's really interesting because I was just having a conversation with a good friend of mine. She and I live in the same condo complex. And so she was out walking her dog last night, and we met on my patio and sat on the opposite ends of my patio and had a glass of wine, and we were talking. And she was saying that she took her car to be serviced, and she has a Lexus, so she'd taken it to the Lexus dealership, and she said, I have this, I felt like, okay, this is a high-end dealership. They're going to be taking good care of things. They're going to be very aware, and they're going to have lots of signage, and it's going to be very obvious that they're doing things well. And she said it was terrible. She said they had done nothing different. They had no signage up. Nobody was wearing masks. Nobody was wearing gloves. And she said, I canceled. She said, I walked in, I sat down, and she said she didn't cancel, but they had several things on the docket for her to take care of. And she said, I started having a panic attack, a mild panic attack, because I was starting to feel anxious about what they were not doing. And she said, I was wearing gloves, I was wearing a mask, but now I was feeling like I was surrounded by people who weren't caring, and they didn't care. And and she said, I'm having anxiety. She was sharing with me that she's starting to have some anxiety surrounding all of this. And I think that's going to be true for a lot of people. She said she's starting to feel anxious leaving her house because of it. And it's so sad. And she's a very level-headed, smart person. But she's concerned about how she's made to feel in businesses. And I think that that's going to be true for our patients as well. Maybe not.
Yeah, at the end of the day, we don't know what we don't know.
Right.
So, and we can all have our opinion, and we can listen to experts, but we don't know. So there are people who, fall to the side of, well, we don't know, so I'm going to soldier on until we do know, and I'll plow right through it. And then we have people who fall to the side of, well, if we don't know, then I'm just going to stay a million miles away until somebody figures it out. And at the end of the day, they're all our patients.
That's right.
So I think you said it very well. Figure, I own dental labs, and, in dental practices, we treat everything. Infection control, the rule is you treat it like it's got the worst thing on it that you can imagine. Every one of them has, an AIDS virus or some kind of virus. You treat all of them the same, and then you're safe, whatever the worst case is. And I think that is going to extend into the dental practice. So So let's sort of transition. So emergency patients are, I mean, maybe that is a temporary clear the counter, clear the, get rid of the stuffed, the teddy bears. And, and it's not a full schedule. So but also it's not a temporary thing, I think is what you're saying. So right now you're doing it because we're on heightened alert. We're wearing masks. We're keeping our social distancing. And even as we get back to normal and start coming back, we don't just say, okay, now that we're all right, let's bring the teddy bears back and hang the philodendron across the back of the cabinets. Let's go back to where we were. You're saying when you come back to be stronger, to be better, to appeal to that patient mindset, there's some things you really need to be looking at long-term, just permanent changes.
Right.
What are some of those?
So, this is really what I've worked with clients on for the last couple of years, is really addressing the practice aesthetic and how it supports our office, how it supports our patients and gives them comfort. And then also how it supports our branding. I'm not a marketing expert. I don't pretend to be a marketing expert, but I know that, like you were talking about, you were reflecting back on the presentation, and I had talked about the office with the beautiful area with the glass coffee table. Well, very clearly their aesthetic supports a brand of high-end aesthetic dentistry and not family dentistry, and that's great. It needs to match. That's the key. And so if they're promoting themselves as a family dentist, a glass coffee table is not a good choice. Mm-hmm. My point with that. Supporting the branding is going to really be helpful moving forward as we're recovering and getting back to work and coming back stronger. The understanding how our aesthetic is supporting our branding is going to be huge. But also understanding that patients, when we start to address things that, we can present we can give a presentation of calm through addressing things that create a sense of harmony in our practice. So we can create harmony through things like the way our team presents. Are they all dressed similar, the same, coordinating, right? Do all of the light bulbs match? I mean, lighting really needs to, if you have 8 banks of fluorescent lights and you've got 6 different temperatures of fluorescent lights, that does not create a sense of harmony for our patients, and they notice. We stop noticing. I mean, nobody sets out to create an ugly aesthetic. Nobody sets out to create a negative patient experience. It's just we stop paying attention, right? Well, what I ask my teams to do is put on your patient eyes, and now the patient eyes have these new lenses called COVID-19. Put on your patient eyes and walk through your practice and start to address the things that patients might see that we stopped noticing, you stopped noticing a while ago. So it's clearing the clutter, it's addressing stains in the carpeting and stained ceiling tiles and magazines and, a dirty sterilization area, ripped chairs in the operatories, whatever that looks like. And it's amazing how this brings a team together. So as practices are starting to qualify for the PPP loans and they're starting to figure out, okay, what is it that I can have my team be doing because I've got to bring them back into the office. They're working now. What are things that we can start addressing? This is a great time to address this, right? Go through the office and look at everything and with patient eyes and start figuring out what is it that we can start addressing that's free. So trash in the parking lot, and let's go through our magazines and, clean the windows and that kind of thing. What are the things that are free? What are the things that might cost a little bit of money? And then what are some things that we can action plan for the future and set goals for the future that might cost more that will really help elevate the practice aesthetic? So this is what I talk about in my ebook, If These Walls Could Talk. And lay out the entire exercise, and it is fantastic. I get so much positive feedback from folks when they take the time. It takes about a morning or an afternoon to go through the whole practice, and my ebook has all the forms that you need and all of that stuff. And they take that time to do it. It is a huge team builder. because everybody pulls together and they just start tackling the stuff and start taking care of the practice. And doctors love it. Every practice I've ever worked with this exercise, they just love the exercise. The team does and the doctor does. So I really encourage people to do that now, for sure.
And it's something you can do that's productive and moving
Yeah.
forward. Where can we get your ebook? Is that online?
It is. So they will go to my website, which is www.onpointspace.com. They can request my ebook, and they will get that sent to them immediately.
Awesome. I'll make sure we put that in the link with the video.
Thank you.
So,
Thank
and
you.
appreciate you offering that up. So, so maybe you said this earlier, and I wanted to just throw this out there. Aerosols, dental aerosols. Andrea, I have heard I've been in this business a long time, and I've heard the term dental aerosols more in, 5 minutes on a Tuesday afternoon than I've heard in 15 years.
Right.
I think there are a lot of dentists who either they sort of knew it, maybe they learned about it in dental school, maybe they didn't care, maybe it wasn't a big deal.
Right.
But it's a hot topic right now.
For sure.
And your patients, and let me step back. I think that might be a good mindset shift for practice owners who are listening to this or watching this, is these are things that used to be you cared about. Maybe you talked about it at a study club. Maybe you talked about it in your 4th year and you've forgotten about it. Today, your patients, they know this stuff. So when it comes to dental aerosols, patients know what aerosols are now, and they also know what dental aerosols are. So you have any advice or thought or tips on just going forward where that fits in, where dental aerosol, just the heightened awareness of a patient and what you might do visually to say, hey, we're safe?
Right. So I don't pretend to be an expert on, some of the equipment. I have an opinion about that I am happy to share about. I really liked, as a patient, I really liked the Isolite, which I'm sure you're familiar, is the mouth prop, isolation, suction, light, all combined in one. I loved it as a patient. I was 100 times more comfortable when I've had that used over a regular mouth prop. I know that will help with some aerosols, but I don't know all the ins and outs of that. I know that right now there's a big market for some, fancy machinery that comes in and, positioned directly over the patient's mouth as you're working, and it, I guess, sucks up the aerosols. I don't know the ins and outs of all of that. I think the more important thing, maybe not more important, I think a minimum thing that we should start really doing is start wearing face shields and start figuring out a way that we can marry our loops and our headlights and the face shield to really protect, because, I remember even in hygiene school hearing, that the mask is good, safety glasses are a must, but really that aerosols can get around it. I remember hearing that back in the day, and we just kind of, were like, oh, well, yeah, it does, but, and we just kept working. And I think that a face shield is going to be a big thing for us to really pay attention to and start really, I think something I see in a lot of offices is that a lot of
So Andrea's back. We dropped the call, but as our new world of technology would have it, we can pick right back up. So Andrea, you're okay. I mean, like a meteor
Great.
house or anything.
No.
Awesome. Okay.
No. So sorry about that.
We were talking about face shields and
Right.
some things you see in a lot of offices.
Yeah, so I've seen for many years, and I've tried very hard to encourage my offices to really pay attention to more closely to the infection control rules. And something I see a lot of offices really not cracking down on is covering their arms. And so I see team members with the long sleeve shirts under their scrubs, and then they wear them both out of the office, or they wear the long sleeves out of the office. that kind of thing. And so I think that's going to be something that we really need to start paying attention to, because we're understanding that this virus can live on fabric, and we're understanding it can live in the hair. And so, you know, and it's not the only virus that does. And so I think we're becoming more aware of the fact that we do need to cover our arms. We need to pay attention to this stuff and not blow it off like it's not a big deal anymore. So I think those are some things that people can do immediately, for sure, is start paying attention more to that.
Yeah, and as we said earlier, I think the important thing is, whatever our personal opinion might be, these are our customers. So if their perception is a very heightened awareness, like your friend, you know, I'm sure she didn't call Alexis and say, hey, I'm not going to get my car repaired there. She goes somewhere else. And in the industry, that's, you know, that's what can happen. I think customers / patients start to think about, you know, they have a new perspective. They don't share it with you. That's the difficult thing. They don't call you and say, oh, I think those teddy bears are really cute, but I'm afraid, you know, I've got 2 kids and I don't know what kind of germs they hold. So it's better to I don't think you have to have a completely white, sterile environment.
No.
Get rid of some of those things you said, like the papers and Post-it notes on the
the Post-it notes.
The piece of paper you taped up there with some instructions 11 years ago and you scratched out and changed. While that's a thing, that's about what you're saying a while ago. You don't even notice that, right?
Right.
But the patient, they think, oh my gosh, how long's that dirty piece? How many patients have sneezed? How many aerosols have flown around the air in here on that piece of paper? And they don't call you to tell you about it. They just don't come back.
Right. Exactly. For sure.
Wow. Well, cool. Well, any closing thoughts for a practice owner who is saying, oh my gosh, I'm overwhelmed? And I think you hit the nail right on the head. If you're bringing your team back, we don't just turn a switch and the schedule's full. We turn a switch and we have a few patients, then a few more patients, and a few more. So you've got some headroom and some time. Any parting thoughts for somebody that just says, I don't even know where to start?
Yeah. So the first thing, as far as the practice aesthetic, is I would definitely encourage people to read that ebook, even if they don't do it right away. Get the ebook. Start thinking about how you can implement that exercise with your team. Talk to your team about it and say, hey, would this be something that we could work on together? Because I think that you know, as we start coming together, I think doctors need to really rely on their teams to help build the culture of the practice back up. And this is it's a great way to do it. And it really has such overwhelming positive attributes, you know, and it's going to really prepare the practice for seeing those patients again. So, I mean, you know, I think it's a great way to start, and it's something that's not, you know, it's a fun thing too. That's the other benefit of it, is it's fun. It's not just all dental. It's not clinical. It's not, you know, learn the software more, which all of those things are very, very important. But this is something fun that a lot of people really get into. So I think it can be really a big team builder and build a lot of morale, which is also going to be very, very important for our patient families coming back, that they see good team morale, for sure.
So, to some degree, you're almost, I don't want to say you're reacquiring your patients, but for a lot of them, you kind of are. You know, you're reestablishing a relationship on a fundamental element that literally didn't exist. I mean, it existed, but, you know, didn't really exist 3 months or 6 months ago. It was on your list of priorities. It was on a whole different sheet of paper, where today it is literally number one. And
and it's huge. The patients, when they walk in, they have to feel like they can trust you. Mm-hmm. And if the practice aesthetic is not 100%, 110%, you're already building in difficulty getting that trust from your patients. So by having a clean, warm, comfortable environment for your patients, and especially in the treatment areas, it's leaps and bounds towards building trust. And they need that right now. And you need that right now, for sure.
Yeah, I'm a declutter kind of guy, Andrea. So, I do it just because I'm very structured, and that helps me get through the day. Like my wife
Sure.
will tell you, I can get ready in the dark. I can get dressed in the dark, and
Wow.
I'll pick the right colored socks.
That's
I've got
great.
the white shirts, I have the blue shirts, and then if it's crazy, I have the striped white and blue shirts, and then wacky might be a little lavender or whatever. There aren't many of those because that's kind of out there.
Yeah.
And
Yeah.
that helps me get through the day. I've done
Sure.
it my entire life, and I feel like there's less I have to think about then. And then
Absolutely. You're 100% right.
she's the opposite. She likes it out where she can see it.
Yeah.
And
Yeah.
that part works. But today, going forward, a patient who walks in just needs to feel like it's it communicates a message that isn't just about being a little cluttery now. It's about
Yes.
an entirely different message you're sending to your patient. So,
Yes.
that's awesome. So if somebody wanted to get a hold of you, how would they get a hold of you?
They can email me at andrea@onpoint.consulting. It's a little bit different than my website. Of course, they can always message me through my website, but so andrea@onpoint.consulting. And I'm happy to work with clients. I work virtually if somebody is looking for some design help or even just some advice as to where to start. I do work virtually with my clients, and I can help them. I just did a perio office in Orlando, so sent them a design board with some new furniture choices to help bring them kind of into a more modern and current aesthetic, and they were very excited. So yeah.
And you're right. It's a good time to do that. And teams do get kind of jazzed. I mean, you don't think they do. You think nobody.
Oh, they do.
But patients sense it and feel it. And that's a good feeling when patients are coming back. Suddenly they say, Doc is really paying attention to this now. And your team sort of gets a little jazzed about, it just feels better. And so, and I'll make sure I have your email also attached in the notes below. So
wonderful. Thank you.
If these walls could talk, onpointspace.com, and they just request that, I would highly suggest that, and it's a free ebook, right?
Yes.
So it's free and you have plenty of time. So why wouldn't you do it? So,
and it won't take you long to read. It might take you about 30 minutes to get through the whole thing if you really study it.
My kind of book. Well, Andrea, I appreciate you being on. Like I said, I know I think we met the first time. We might have met before, but I hadn't seen your presentation. And I like things that are very tactical, that a doc can sit and watch and say, wow, I want him to go back and say, I never gave that a second thought. And gee, while those teddy bears are really neat, they do kind of communicate this. Or if I was a mom with 2 little kids, that beautiful, the decorator who charged me, out the nose, all this beautiful thing, never gave it a second thought. So that's the kind of thing I like to walk away with and feel like that practice owners can turn to an expert, a subject matter expert like yourself, and really should do that. I always encourage, don't try to be an expert on everything. Turn to somebody who does all they do. So that's all. That's right. Well, Andrea, I appreciate it. And I hope to see you out and about sometime. You and I travel a lot and speak a lot. In the circles, it is a different world right now. It is. It's going to be interesting. It's a technology world versus an airplane and hotel world. So yeah. Well, Andrea, thanks for being on. And practice owners, I think again, we'll give you some free advice. If these walls could talk, onpointspace.com. Reach out to Andrea. And until next time, hang in there, and we'll hope to see you coming back stronger. Thank you. Bye-bye. Bye.